Welcome to the True Health Tuesday, and the truth will set you free. So here we are in our new format, and I hope you're going to like this because we can get into greater detail. Today's talk is going to be on the overlooked contributing factors to the Parkinson's adaptation and the difference between adaptation and disease. Let's look at this. Now, what I want you to do is post your questions below this video, and we're going to answer those again on a live video. It'll be posted later on in the week. Also, the uncensored portion, because there are some contributing factors that the censors won't allow us to talk about, that'll be posted on the Dr. B VIP in a Q&A or question and response. So let's get into this. Parkinson's Disease Foundation says it's a malfunction or death of vital nerve cells in the brain called neurons. Well, really, and so then when you see the movement, the mask face expression, the slow movement, okay, that rigidity, stiffness, that is really the body adapting to the death of the neurons. Think of this. That's not the disease. That's the body adapting to the death of the neurons. So we're looking at over 1 million Americans have it, 10 million people worldwide, and the cause is unknown. Really? Let's look at that. Medications and surgery, no one's suffering from a lack of those. So the overlooked contributing factors are physical, chemical, and emotional stress. Because remember, we're talking about the death of neurons. So these movements, the mass face, the slow movement, that's the body adapting to the death of neurons. That's for sure. Now, here we're looking at a normal x-ray on the left-hand side. That's a normal curve in the neck. Now, the brain doesn't stop at the skull. There's an oblong section of the brain that extends the top third of the neck. And what you'll see consistently, and I'm talking so far 100% of the patients, is there's massive forward head carriage and loss of curve in the neck. So that's throwing the head forward. What does that do? There's no stretch fibers inside of that central nervous system. So this is pulling on the brainstem. Now that brainstem literally is connected up to this area where it's called substantia nigra, where dopamine is produced inside of the brain. So there had to be a trauma causing this physical distortion of that area. And it is located smack dab in the middle of the brain. But I want you to look at the brain completely different. The brain is functioning in a whole different world than what anything else is. It creates its own food called cerebral spinal fluid. And that fluid actually flows from that whole brain down through the opening in the back of the skull. It's called a foramen magnum, which just means big hole. And that cerebral spinal fluid flows down. Now, there's a barrier between the blood and the brain, and that's called a blood-brain barrier. This is why you can drink coffee or stimulant, or you can drink alcohol, and the brain really needs to function in its own environment because it can't have highs and lows. And in fact, if you look at this brain, there's more connections in that brain than there are stars in the sky. The brain is amazing. But with that forward head carriage, you're choking off that flow of cerebral spinal fluid. So it's not going to function correctly. Now, again, substantia nigra is damaged. Why? What we've seen is forward head carriage. So there's a physical trauma to it. And then those neurons that produce the dopamine don't produce the dopamine. What does movement do? Movement triggers dopamine. Now, and we're going to look at before and after. And this is a 76-year-old gal, 12 years of Parkinson's. By correcting the movement, that involuntary movement decreased. She went from a wheelchair to a walker. But again, that's only addressing one part, the physical stressors. When we look at this, we can see the forward head carriage. That forward head carriage does two things of an advantage to the patient. One, it's going to help get more sensory input into the brain. So when they're walking, they get more input. This is why if you have somebody who has this Parkinson's diagnosis, just for the heck of it, have them walk barefoot with on grass or hard sand. Why barefoot? You're getting more stimulus to the brain. You're going to see faster movements. This is why in exercises for Parkinson's, We give them weights in their arms and have them moving in a cross crawl fashion, because that movement, even though if you're helping them and you're moving those joints, it helps get stimulus up to the brain. Because remember, that movement is actually the body adapting, trying to generate dopamine. And if you change that posture, you're changing the nutrients in that brain that are produced, that cerebral spinal fluid. It flows down that brain and gives nutrients to the spinal cord. Healing the gut is hugely important. Healing the gut is vital because this is where neurotransmitters are produced. Remember, when you have Parkinson's, you are in a completely stressed state. So you have decreased blood supply to the gut. So healing the gut, and what's the special diet? There isn't any. Okay. Look at healthy fats. Look at stuff your great great grandparents would recognize. Remember, they only ate organic, they only ate fresh. They might have eaten preservatives or fermented foods, which has healthy bacteria. Blend the fruits, raw dairy to get the bacteria in there. If they've had medications in the past, they may have a leaky gut that has to be healed. Fats are the most important thing that you can get in the system. Omega 3s of anchovy, mackerel, sardines, fantastically important. This is why we put this up at the end of every talk. You need to get the nerve supply. Why? Because you need to have a nerve supply up to the brain, and the brain will have better control of the body. Regular exercise. And with Parkinson's, it's got to be symmetrical exercise. We're going to cover these exercises in detail. And typically, it's going to be using a weight. Why would you use weights? Because it opens up the knee joints. Every joint, knee, elbow, shoulder, they have sensors on there. And if you put a weight on there, it opens it and you get more sensory input to the brain. And you're going to see people with Parkinson's, if they try and swing their arms, they're not going to be doing well. You give them a weight to open up those joints, they're going to have better control. That's why you have somebody walking on a hard, flat surface with shoes, their gait is going to be radically different if you walk barefoot in the grass. Proper nutrition, that means a man makes it, you don't eat it. Sufficient rest. We've got to reset their circadian rhythms. Look at our sleep videos. It's going to be vital. And then prayer and meditation. You got to deal with that emotional component, and connecting with a power greater than you is going to be the key. So post your questions below this video. We're going to do a follow-up video where we're going to answer as many of those questions as we can. And also, there's the uncensored portion with the materials that we cannot talk about on this video will be posted on the Dr. B VIP. God bless you, and I hope you like our True Health Tuesdays, baby.